Well, in recent months, we've learned a lot about One World Community Health Center. They make it their mission to provide health care to the underserved.
That means services all around Omaha and outside city limits as well.
Yeah, including their Cass Family Medicine Office. Associate Nursing Director Liliana Jorgensen is here. Good to see you, Liliana. As well as Nurse Manager Laura Lowens. Good to see both of you this morning. Let's start with the clinics. We've learned a lot about One World over probably the last year, I think. But the satellite clinics, where are they and what's the history?
So Cass Family Medicine is actually one of the first satellite clinic that opened through One World, and we are located in Plattsmouth and right off of Main and 6th Street right there.
Yeah, what was the reason behind opening that clinic?
That is, it's a very small community, one that really just needs our services, and one of the communities that we strive to help, one that really needs our help. So we love the population down there. The building that we're in now, we've only been in for a year. The old one burned down a couple years ago, so we're settling into the new one, and we love it there.
What kind of services do you offer there for people that may not be familiar?
The services we offer, we see patients, newborn up to adult, and we offer new patient visits, well child checks, just to really establish care with a provider down there, well woman exams, all sorts of anything that you'd see a patient or a provider for, yeah.
And if for specific medical issues or medical conditions, you can monitor certain conditions. What would that be?
Well, most of the or some of the most common conditions that we see are hypertension, diabetes, depression. Those are just some of the conditions that we have there. We see that there are some patients that just come to us for first time, and they are not even able, they have one of those conditions, they have no symptoms at all, and then when they come to us, they just find out that they're having hypertension, like really high numbers or so. So it's important that patients will come to us, just general checkup, annual checkup, and just to make sure that they don't have any condition that they don't know about, and just to prevent complications.
Can really be dangerous. I mean, those conditions, if they're unmonitored or undiagnosed, to go continue. So it's a really wonderful service.
Yes, and also, it's important for patients to follow up. If the provider tell the patient, okay, you need to follow up in a month or in 2 weeks or 3 months, it's important patients come back to us and follow up. They will start on medications, but it doesn't mean that your condition is under control. We need to make sure that the medications are really working, and they don't need any medications, anything new to start on.
Yeah, Liliana, you brought up a very good point, is getting those patients to come back, because hypertension, diabetes, it can be a serious issue. How do you go about getting those patients to come back? I mean, because sometimes that can be a challenge. What do you tell them?
Well, when we see those patients, especially first time, and it's important that patients understand the condition. They have some knowledge. They know what everything is about. They know they can identify symptoms and signs. They can identify, any complications. Also, if they're taking any new medications, they need to know what they're taking those medications for, side effects, things like that. And we just advise those patients to come back for follow-up appointments, because they may need labs. They probably have new questions about the condition. They have any concerns. So we really advise patients to come back and follow up with the doctor.
A lot of discussion about mental health in our country, and you offer behavioral health services as well.
Yeah.
Can you tell us a little bit about that and what it's doing for people?
Yeah, sure. So we have something new. We just started like a year ago. We're very, very excited. It's telehealth is something like a Skype. So what we do is that we have a counselor available most of the time at the satellite locations, but if we don't have that person available, we kind of use a Skype or telehealth for those patients, and it's actually like working really well. I think patients are getting, they feeling better about it, and so we are offering that service more often for those patients that need it.
And how's that working out? Because I know sometimes it's hard for people to get used to that type of health care over Skype or over a video conference. How's that working out? How are patients responding to it?
I think they're responding really well, especially young population. They are very involved with technology, so for them it's probably something easier to deal with. But for our patients that are probably very into technology, it's a little bit more challenging. So, we offer those services, but if the patient doesn't want it, we also have a counselor in the site. So
Yeah, and we've been talking to you, like I said, over a year, One World Community Health, and we know about the Livestock Exchange building. We're talking about the satellite clinic today in Plattsmouth. But in terms of how a lot of these patients pay, would you explain that, specifically surrounding behavioral health services?
Mm-hmm. So any One World location, we do offer sliding fee scales for patients where we base it off of their income. So we have different fees that they can pay based off of how much money they make so that it's more affordable for patients. And the same goes for behavioral health services. If the provider recommends that the patient be seen for behavioral health, then those first visits are free to that patient too. So they're included in the cost of the visit. So.
Really a huge piece of information for people to have, because some people assume that the way it has been in the past might prohibit them cost-wise from coming in. So.
Yeah, and you've been expanding those services and expanding it to different regions, not only down there in South Omaha at the Livestock Exchange building, but Plattsmouth, and that's the new Cass Family Medicine Clinic, 122 South 6th Street. You can give them a call, 402-296-2345. Also, you can go to the website that we've been showing at the bottom of the screen for this segment. oneworldomaha.org is the website that you can go to. Thanks for stopping in, and good to see you.
Thank you.
Yeah,
Thank you.
appreciate it.
Thank
Thanks a
you.
lot, Liliana. All right, our live